An estimated 2.2 billion people worldwide are said to be visually impaired. That is about a quarter of the world's population. Although the statistics on visually impaired persons in Nigeria vary, experts seem to agree that more than 1 million persons live with visual impairment in the country, and of course, there could be a lot more. Challenges that come with loss of vision include restricted mobility, lack of independence, social isolation, poor mental health in some cases, as well as increased risks of injuries. However, there are visually impaired persons who have defied the odds to make their lives worth living, as we shall see in the course of this episode of 30 Minutes. Welcome to the program. I am Mitaire Ikpen. Our focus today is care for the eyes, and this cannot be overemphasized as the eyes are windows to the world. As indicated earlier, loss of vision comes with a range of challenges, and we shall see these challenges through the eyes of those who know what it feels like to lose their vision or be born with visual impairment. Oyeyemi Ajayi is our guide.
It is not easy at all. Anybody that says it's easy, let the person try like tying his eyes for let me just say 1 hour for you to know how it felt.
Adelbi Abonyi is 27 years old. She became visually impaired at the age of 6 when she experienced domestic violence from a guardian who promised her a better life in the city.
She now said I should go and wash that cloth, that napkin. I didn't wash it well. That was now she now used that firewood, as in the remaining firewood that they used to cook food. She now used, she was hitting me all over my body. That one couldn't help. She now go and use belt, that belt now. So when she was flogging me, I don't know whether it's mistakenly or that head of belt now hit me on my eyes. That was when I now fell down. Blood splashed everywhere. So blood was even gushing out of my eyes. And then lie down. I was crying so bitterly.
The case of Mrs. Anne Ekandem could be a little different, as she never had the opportunity to know what it means to see, as she was born with visual impairment.
Initially, when I was at the Pachali School for the Blind in Lagos, I didn't really know what challenges could be, because all of us there were blind. It was a school for the blind and partially sighted. But when I went into the secondary school, when I had to compete with others that are not blind, then I started seeing the real thing. You have a document like this, you want to read it, you cannot read it. Now I can read it. But then I didn't know what to do. You beg people to help you. Some will not. If they read for you and your result is better than them, obviously they will not read again. So you keep going up and down the struggles of life like that.
Adelbi Abonyi and Anne Ekandem represent thousands of visually impaired Nigerians with different stories to tell. For Anne Ekandem, she braved all odds to rise through the ranks of a career to a senior level at the Federal Civil Service, but definitely not on a platter.
It wasn't easy. It wasn't, I have to tell you. Even recently, we wrote a promotion exam to the directorate cadre. The result is yet to come out. But even when I went for that screening exercise, some people were saying, what is this one too here for? Me, I will tell you, you too, what are you here for? And the thing will carry you come, now carry me come too. But it's not all persons with disabilities that will be bold enough to answer like that. We have introverts, we have extroverts, so it depends on which category you belong or how you have trained yourself.
Adelbi, who is just finding a way through life and trying to understand her situation, is not finding it easy. While a family could be quite encouraging, the society is not.
I tried taking sniper, which God intervened. Then I now as in found another option to sell my kidney. Do you know that my mom as in she went to the extent of telling one doctor to remove her eye, one of her eyes, so that they will fix it on my own for me to use her eyes to see. My mom have tried for me a lot.
One thing that serves as motivation to them is the fact that there is a level of ability in every disability, no matter the obstacle. Adelby still dreams of owning the biggest shoemaking factory in the country. That informed why she enrolled in a vocational school with some shoes made to her credit.
The way that I earned this Stevie Wonder, his own is in music, yes, and cool bands are so cool. Their own is music, but I want to be creative with my hands. A blind person having a world class company, me now having shoemaker company. Oh no, oh my God, I'll be very happy, yeah, if I see the support.
Besides her entrepreneurial disposition, Adelby is also an athlete despite being visually impaired. Her favorite sports include martial arts, football, karate, judo, and tongi mundo. She won a gold medal in karate at the just concluded National Parasport Festival in April.
We never knew someone with disability would come when we were told students are coming. So when I saw her initially, I wasn't like, how is it going to be possible? But I come to understand that in life, one don't have to give up whenever you made up a choice. So when I saw her, I just believe, and with her knowledge and skills and smartness, I saw that zeal in her, and I saw the ability that she can do it.
Well, when she came, I was so marveled to see somebody like that wants to learn how to learn shoemaking. At first, I felt, can this be possible? But later on, as the training was going on, she really threw us of the balance, the way she was doing her work, sewing, everything. It was so perfect. Now, we are proud of her.
For Anne Ekandem, she is lucky to have a loving husband and a caring son who bring her to and from work every day.
We come out in the morning, and in the afternoon, he comes to pick me. If he doesn't come, I will take a boat trip or Uber trip back home and move on with life. But I will miss the sight if I had experienced it before. I want you to understand that because I have not experienced it, I will not say I really miss it. What if the battery of this phone is dead? How do you pull through? So obviously I miss the sight. Because in my own home, for example, everyone is used to putting these things the way they are. You don't scatter it, because that is the way I know it should be. Yes. So we don't misplace things. Everything, if you had come to my home, then you will understand what it is. And so I can navigate through the home itself. But it's not like going to another home. I have not had an orientation of that place. But in my own home, I have a full orientation of everything because it is the way I want it to be arranged. So my people have formed the habit of anything you use, you replace it back because I know it should be there.
Not many are as fortunate as Anne Ekandem. There is a compelling need, therefore, for the government, well-meaning Nigerians and corporate bodies to make provisions for special needs of visually impaired persons around them so they can compete favorably in the society.
They don't have all the assistive devices they need to climb up. And you also have to teach them even how to use those assistive devices. Like I do tell people using even Android phones, I say your phone has speech. It's just because you being sighted, you don't impute the speech, you don't activate it. It has the speech. Everything is competitive. WAEC will not know whether you had textbooks or not. They don't even want to know. Their own is, what did she write? Did she pass the exam? What do we give her? That's what they want to know.
Undeterred by her impairment, Adaobi's determination to be the best in whatever she does is apparent, and not even the loss of her sight would deter her from fulfilling her future dream.
Those are quite emotional stories with lessons on the need to guard our vision jealously, and that all hope is not lost even if one is visually impaired. Now, what are the risk factors that could trigger loss of vision, and how can we guard against them? We will hear from experts who spoke with Thomas Ogbetere.
The eyes are among the most important sense organs which allow a person to connect with his or her surroundings. Health experts emphasize that the eyes keep one safe and mentally alert. Little wonder the need to take good care of the human eyes has been the primary focus of World Health Organization (WHO) for 2 consecutive years, by retaining Love Your Sight as the theme of the 2021 and 2022 World Sight Day respectively. The eyes is so sensitive that it is estimated that an adult blinks an average of 12 times per minute. Dr. Abubakar Tafida, an ophthalmologist, is the FCT Secretary of Health and Human Services. He says protecting the eyes from being hit or having contact with harmful chemicals cannot be compromised.
So the most important thing is for anybody to be conscious of his eyes, to be aware about what makes the eye to remain healthy. And by that, it means you make the conscious effort, go to hospital for a regular checkup.
Eye is the life that we have, in the sense that it will make us to see, appreciate. It will make us to go to primary school, listen to our teachers, secondary school, university. And when we are walking, either you're walking in the villa or in the NTA without sight, my dear brother, can you?
Now, once everyone has reached the age of 40, you should have your eyes examined at least once every year. Proper eye examination, not just close one eye, can you read, close the other eye, you cannot read. The eyes, there's a lot in the eyes. The inside of the eyes had to be examined, the blood vessels, everything needs to be examined.
He also speaks on other risk factors that could trigger vision loss.
Statistics have shown that about 17% of Nigerians that are blind are as a result of glaucoma. Adding to the 50% as a result of cataract, this is an enormous burden and a situation where if people are aware and strategies are put in place, they can easily be treated or prevented from being blind.
As a young man you have to avoid having misunderstanding with somebody that may lead to fight. Because when two people are fighting, by mistake, one can take his hand and hit the eye. My dear, after 1, 2, 3 months, you can understand the trauma the person is going to have. 2, whenever we are going around, we must be very careful to hit our eyes anywhere. It's still trauma.
I had a patient who were managing for glaucoma for close to 30 years in that place of where I was working at the time. Close to 30 years. This was an elderly man in his 70s, were managing for glaucoma. And then one day, his son was having his bath and soap entered his eye. So while he was trying to wash off the soap from one eye, he noticed the other eye was open. Not the eye soap entered now. The eye soap did not enter, was open, but he was not seeing anything. So they rushed him to the clinic that day with the father. The father was wondering, this is what my son said. So they came. And when they came, we discovered that the son that had gone blind, this was a 24-year-old, he was a youth corper at the time. He was totally blind from the same glaucoma that his father has been managing for over 30 years in one eye. And this eye that soap entered, not because of the soap now, because there's already been glaucoma in that eye, was already almost completely going too. So we had to start treatment to prevent that good eye from going blind. Now, if he had been having his eyes examined the way his father was, knowing that his father had glaucoma, if he had because this was his first time testing his eyes, that's because if his father was discovered to have glaucoma at some point, and the father has been managing for 30 years, and the man has not gone blind. Now his son has never tested his eyes, and he's already blind because he did not have his eyes examined on time. That glaucoma, if it was discovered on time, it could have been salvaged. So that's why we say, whether there is any problem or not, walk into an eye clinic, have your eyes properly examined.
Although challenges with the eyes can occur in any age group, from children to adults, it is however believed that persons above 60 years are mostly prone to outright vision loss. Eye checks and tests for everyone, especially those above 40, are therefore recommended, among other measures.
It is important for people that are at risk, especially in the elderly. It is recommended in Nigeria that people above the age of 30 should have a regular eye check to be sure that they do not have any condition that will result in such loss of vision.
When you get to that 40, the ability of the muscles of the eye to control the lens inside the eyes, to read, to contract, to read, expand, to see at distance, that ability will be going down gradually. And when you get to that age, most people can no more read either their Bible or their Quran unless they squeeze their faces or they send it out. But then by the time you meet an eye doctor, eye practitioner, when he examines you, he will not know where the problem lies. And then, of course, after the refraction, definitely he or she will give you the correcting lens to assist you read very well.
Loss of vision has its own toll on the individual and the nation.
Eye is very, very important to the economy of the country. If you don't have eyes, you can work in a factory. Anybody that has good sight can go to farm, plant cassava, plant yam, plant everything, and bring to the market for you and I and everybody to buy. But any person that haven't got his eyes cannot do that.
If, for instance, there is a 40-year-old man who has gone blind, and he has probably an 8 or 10-year-old son, the high chances is that that son will be out of school to help the father move around. So now that child that would have gotten a good education to have a chance of taking the family out of poverty will end up taking his time of education to be carrying the father everywhere the father needs to go to, helping him around in the house and all of that. Now, so we've not just lost the father who is now not productive, we are now losing the next generation to unproductivity because that child is most likely never going to be educated. Apart from the fact that the father may not be able to earn enough money to be able to send his children to give them a proper education, but then again, the child cannot even be productive too.
Imagine their inability to perform daily chores, inability to be able to catch up for yourself, inability to progress, and inability even to get accepted within the community simply because one has lost his sight. Studies in many parts of the country of the world have proven that people that are blind are both physically, economically, and socially challenged. Their quality of life is drastically reduced, and there is high incidence or high relationship between loss of vision and poverty.
During work hours, they're always having headache, always having eye pain, the eyes are always tearing, fatigue, just because of the eyes. Okay, and then there's the other side of total blindness that one is not even able to generate anything economically. So man hours end up being affected. What could have been done in a day or 2 days is done in 10 days. So man hours is reduced, productivity is reduced, and at the end of the day, it's our economy that is being affected.
Statistics vary about the number of visually impaired persons in Nigeria and the world at large, but there are growing concerns over the number of visually impaired persons in Nigeria, especially as more than 80% of cases are either preventable or treatable if detected early.
In Nigeria, every 1 out of 25 Nigerians has one form of visual impairment or being blind. Unfortunately, 84% of these people with blindness or some form of visual impairment in our country can be treated or prevented from getting blind. Of course, about 50% of those blind in Nigeria is as a result of what we call cataract, which is a gradual painless loss of vision that can effectively be treated with a simple operation in a hospital.
To address the growing number of persons going blind, especially for preventable cases, government is advised to establish ophthalmology departments at all levels of the healthcare system across Nigeria.
It means that we need more doctors. We need more eye doctors trained. And we need them deployed to many places. We go to local governments. We're 5 local governments around. There is no eye doctor at all. At least of the 774 local government areas in Nigeria, at least there should be one optometrist employed. That way, the access to eye care can be better so that someone can just walk in and say, okay, at least if I go to my local government headquarters, I'll see an eye doctor in the health center there that can at least check.
The federal government, through the Federal Ministry of Health in collaboration with the Federal Capital Territory Administration, have been engaging in awareness creation, free eye tests and checks, as well as treatment, provision of eyeglasses, and free eye surgical operations for those who have cataracts and other similar eye problems that may require surgical operations.
We were privileged to go to the National Assembly so that we can solicit and advocate for legislation of key policies and laws that will positively impact eye care program. We were privileged to have the key principles of the National Assembly to be assessed. And here, our FCT minister graciously came to Asokoro District Hospital, where we have his eyes checked, and he had wonderful messages for the people of FCT, whereby he advised them on regular checkup on their eyes. We have been looking at especially the key leading causes of blindness in the country. Just in June, we operated 500 cataract cases at Kwali General Hospital. And actually, this was graciously approved by our Honorable Minister, and we are making a good effort to develop what we call a high volume, high cataract surgical center at Kwali, because it's strategic to cater for the people, especially the rural populace, not only within the FCT, but states like Kogi and Niger State. And we are quietly, though, upgrading all our ophthalmic units in all our hospitals, and very soon we will hope to start sophisticated eye surgery such as phaco surgery. We are beginning to start medical retina treatment using laser, and we are going into quite a number of collaborations so that people don't need to be traveling abroad.
Nigerians are advised to regularly eat lots of fruits and other diets that could enhance their vision, while shunning all lifestyle habits that can be injurious to the eyes.
Of course, Thomas, the bottom line is love your eyes and keep an eye on your eyes. Even if you think your vision is fine, it is important you go for regular eye checks and examination by a qualified professional, that is, an ophthalmologist. And that's it for this episode of 30 Minutes. We hope it was worth your time. Until we come your way again next week with another engaging topic, my name is Mitaire Ikpen, saying again, keep an eye on your eyes.